point. Let's start by talking about the opioid epidemic and where we started and where we're going. And the Rehab Aid put together a really, what I feel like is a very impactful time lapse here, where you can see how over time the amount of, as the states get darker, the amount of drug overdose deaths increases. And this only goes up through 2019, although you can kind of see the trend increasing. And unfortunately, since that time, it hasn't actually gotten any better, unfortunately. And just doing, the before and after, this is what it looks like in terms of where it started and where it is right now. And unfortunately, we have not had a single year where this number has gone down, and it even spiked by a pretty dramatic amount over the course of the pandemic. And where that sits right now is in the past 12 months, the most recent data that we have. The CDC is always pushing this out. There are currently 84,000 overdose deaths due to opioids, and that makes up 76% of all drug overdose deaths. So the vast majority. And it's right now the current leading cause of accidental death in the entire country. The second most common is motor vehicle accidents, and it's over 2 times as common as motor vehicle accidents. So it's very, there's a lot of these. To also put in perspective, the total number of deaths in the Iraq and Afghanistan wars for us was 7,000 over all of those years. And we're losing right now 84,000 people a year over year. Quick side note, and we won't be talking as much about these substances today, but alcohol has for about a decade killed 100,000 people, and tobacco has killed about 480,000 people. Every single year for going back decades. So not to minimize this at all, but also just as if you're thinking about addiction broadly, and particularly drugs that are legal and easily accessible versus ones that in this case are either illegal or prescription based. It's a huge problem, drug-related death in this country. And opioids absolutely, particularly now, is one of them. The number is 231 Americans are dying every single day from an opioid overdose, which is a staggering number. But, and we'll talk about this more in terms of our entry points into fixing this, there are thousands who are treated for non-fatal overdoses every day in emergency departments. And that's because you can look at overdoses as being an end-stage symptom of a broader problem. And so there's a lot of folks who are perhaps on their way to having an overdose, but aren't there yet. And that represents a tremendous opportunity to start to change this. In some ways right now, the people who are currently dying have been in a pipeline towards that for quite a period of time, with fentanyl contamination notwithstanding. We're going to talk quite a bit about fentanyl today. But in terms of the country and how this looks, so this is, again, that most recent map that's been released through April 2023. If you look at the past year, what are the trends? It's actually very interesting that there are certain states where the number is very, very bad, actually. So Oregon and Washington, for example, I think Washington is the worst at year over year. There's been a 30% increase. I think Oregon is 23. And some of the darkest blue states, like Indiana, Arkansas, they're down. I think they're 10% fewer overdose deaths. And exactly why there's this big discrepancy is still very much up for debate. I would love to see some sort of national panel, perhaps of the top 5 states over the past year who have reduced these deaths, to hear what they're up to and what's worked for them. But overall, right now, across the entire United States in the last year, it's gone up by another 1.7%. So this is a problem that continues to grow. Worth mentioning, this also continues to grow for alcohol, like I was mentioning before, and some other drug-related issues. But this certainly is one of them and has caught national attention for a reason. And we're going to talk a lot more about why that's the case. Now, in terms of the waves of the opioid epidemic, there have been 4 waves that have been identified at this point. And we're going to talk a little bit about history and then more about the present, but to just kind of see how this has morphed. So the first wave of the opioid epidemic, which started really was seen as, when you look at these overdoses increasing, that green line is prescription opioid deaths. And it started with drugs that came out of doctors' offices. And there was a graph that was published almost a decade ago now that was really, trying to sound the alarm on this. trend that when you look at the amount of kilograms of opioids that were being sold and the deaths due to opioid overdose and the admissions to treatment, that all of those, the slopes of those lines are pretty linear, right? Like they're all kind of moving in the same direction. The more opioids we're dispensing, the more people who are dying and the more people who need to go to treatment. And that was this first trend. And part of the reason why this took off was that there was a tremendous amount of misinformation being spread. Purdue Pharma being, front and center in this, but others were guilty of it as well, about how opioids are not actually all that addictive. The statistic that was bandied about was that 1% of people who used opioids, specifically oxycodone, would become addicted to it. And that was just wholly untrue. I mean, that was a lie. This study came out, gosh, it's probably been like 6 years now. But it was very massive national sample from the CDC. What they were looking at was what's the probability in 1 in 3 years that you'll still be using opioids based on the number of days of your first opioid prescription ever. And you can see that for people who got just 1 day's worth, actually 6% of those people, so like 1 in 22 or so, were using opioids a year later in some capacity. And 3-year probability was not 0 for that. If you go up to 11 days, though, that's where you see this first. So even a 10-day supply, 1 in 5 people would still be on it a year later, and 1 in 10 would be on it 3 years later with a 10-day supply. You can see this massive jump at 11. But if we go out to a month, that's where it starts to get staggering, because this is where we used to see this a lot post-surgically, like someone has a hip replacement or a spine surgery or something where you've got a recovery process and you got to go to like PT for some rehab. At 30 days, and there's another jump at 31, but at 30 days, 1 in 3 people would still be using opioids a year later, and 1 in 5, 3 years later. And one of the things about opioids is that they are actually not indicated in most cases for chronic non-malignant pain. So basically, chronic pain that's not cancer related, generally speaking, opioids are not the best solution because they're addictive. You form dependencies on them. They have side effects when you take them in higher doses. There's a lot of other negative side effects that come from taking high doses of opioids. Not a good thing. Don't want to be taking them forever. They've got their uses. They actually, it's very important, for example, to be able to engage in the PT process after you go through a surgery. So yeah, actually for many people, they really should be using opioids post-surgically, but that needs to be minimized. There needs to be a taper plan. There needs to be a lot of transparency around chemical dependency and to talk about it. If you start experiencing symptoms or you're starting to get concerned, none of that used to be happening. And even now, to be honest with you, it doesn't happen nearly as much as it should. But they're actually very, very habit forming, particularly if you take them for any extended period of time. And but that messaging out was a huge part of the problem. Additionally, there's the issue of doctors having their patient satisfaction scores being either tied directly to reimbursement or just mattering a lot. And that makes sense, right? You don't want patients to be like, my doctor is terrible, I never want to go back. It makes sense that hospital systems would value that. But at the same time, pain is a driver. If someone's in pain or they don't feel like their doctor is helping them with their pain, they're going to be more likely to give a low satisfaction score, which then when we think about, okay, well, what if, the primary care doctor just prescribes the opioids for low back pain because, I want my score to be okay. That's where you start getting yourself into trouble, and you start getting into overprescribing, which is even honestly to this day where most people are getting their opioids from. When this was a study that really spoke to me, when they asked people for those who are misusing opioids, so non-medical use, and if we go to this far right category, when people are using opioids recreationally, essentially for 200 to 365 days over the last year, so very frequent use of opioids recreationally, where are you getting this from? Most of them are getting it from one or more than one physician. That's the red bar. The next highest bar is given by a friend or relative for free, who generally gets it from a physician. The purple one is you bought it from a friend or a relative, who again gets it from a physician. And those are the top 3 bars. drug dealers actually only comprise about 15% of where people were getting their prescription opioids from. And they also primarily were getting them from pharmacies. They were getting them from doctors. What they would do is they would actually pay for a patient to go to their doctor, pain clinic, PCP, whoever it is. And like they would maybe even pay for their transportation. And then they would buy half of what they were prescribed off of them, leave them with the other half. And that half would be enough for the patient. The drug dealer gets pills to upsell. Nowadays, actually, there are more basically counterfeit pills called press pills that you can buy off the dark web or from drug dealers. That's part of where the fentanyl overdoses are coming from. We'll get to that in a minute, because counterfeit pills, any street drugs right now, very high percentage, relatively speaking, of them being contaminated with fentanyl, which is very potent, and more on that in a minute. But again, it started very much with prescriptions, and there were a lot of people dying due to this, about 20, 30,000 a year dying from prescriptions. And the National Safety Council made actually a memorial to this that was very moving. They made this pill wall to represent all the people who died. They laser carved these faces into the fake pills. They weren't real ones. But it's really pretty arresting to look at this wall of people dying every year. And it was pretty bad for a time. But here's the thing. It actually did get better in terms of prescribing patterns. There was this peak in prescribing in the early 2010s. And then when we really got wise to what was going on, and we published on it, we came out with guidelines, all that good stuff, legitimately good stuff. We've seen this very clear decrease in opioid prescribing. Some would even say actually too steep, where now there are people who might actually need them who aren't getting them anymore. But for the most part, when you look at compared to 2006, fairly comparable, particularly when you think of an aging population in general. Done pretty well in that regard. But overdoses are still going up. And there's a reason for that. This is a photo of, if someone wants to consume it, who is opioid naive, a fatal amount of heroin versus a fatal amount of fentanyl. And that's like, grains of sand. And so when you think about the fact that this is being cut into drugs by people literally using magic bullet blenders, Sam Quinones wrote a really, really great book about the current wave of methamphetamine called The Least of Us. Really great book. I've read it. I actually interviewed him on my podcast about 6-8 months ago, I think. Very interesting guy, very knowledgeable guy. But it's just so deadly, and it's being mixed into these substances in just very slapdash kind of ways. Which again, it's not that drug dealers want to kill their customers, but it's just economics. And the way it all works out is that it's better for them this way to do it. Now, unfortunately, the community that is bearing the brunt of this expansion in fentanyl, and there are a lot of them, but in overdose deaths, are kids. And we're seeing right now that kids aged 12 to 17, adolescents, are far and away look at the slope of overdose increases for kids due to fentanyl between 2019 and 2021. Staggering, right? Look at that huge, they break it out by ethnicity here on the right. And there are definitely some differences there as well, though the slope for many of them is going in the same direction. It's hitting the indigenous populations the hardest. But the kids in particular, why this is so dramatically steeper than everybody else, even though it's pretty steep for everybody else as well, is that this is kids have no opioid tolerance at all. And they're usually getting it by accident. This was something that's out there and was going around a lot, rainbow fentanyl, where literally fentanyl was being put into things that candies is basically that look like sweet tarts, which is like, I have no idea how you sleep at night making this stuff, because it's like, I think we all know where it's going, and that's just absolutely horrifying. But this is where we are. And rainbow fentanyl is a thing. And the problem is that, again, like there's zero, kids have no idea what they're using. It's so much accidental death, where you've got a kid who's experimenting with something that they might not think will kill them. Sure, it's probably not good for them, but not that they're going to die from it, and then they end up dying from it. Huge, huge problem right now amongst adolescents in terms of this accidental fentanyl exposure.